Welcome back. My name is Dr. Derek Bruno. I'm a chiropractor and I focus on neuropathy here at the Liebman Wellness Center. This is the foundation point of elite neuropathy solutions. And while Dr. Jesse's been in practice for almost 25 years now, if not a little longer, what we get to talk about today is the last 10 to 15 years of focus. Neuropathy, chronic pain, and the issues that go along with it. Chronic, it's a word that means time, right? So if you have something that's been described as chronic, it means it's ongoing and ongoing and ongoing. It's not getting better, is it? What we found is that things can change, you can heal, and today we're here to talk about decompression therapy, which is one of the major factors in allowing that to happen. For those of you who have been dealing with sciatica, weakness, heaviness in your legs when you try to get out of a chair, maybe you have to push yourself really difficult to get up, and you even have to catch your balance. Maybe you've noticed that you bend over when you're pushing a shopping cart, or perhaps you've already been diagnosed with a condition, either compression, herniations, or bulges in your discs. Perhaps you're dealing with fusions, laminectomies, or some post-surgical issues from either your neck or your spine. All of these challenges can lead to sciatica, cramping, pain, spasms, pain in your knees, pain in your legs, and even what we would call referred pain or radicular pain, which means it comes right from your back and travels down into your legs, into your feet, or right from your neck and down your arms into specific fingers and down specific nerves. Decompression is much different than traction, which you've likely heard of. Traction is a pull and a hold, and that is it. After 10 to 20 minutes, they let you down and send you out of the office. What you'll find is that this is the same thing that happens with an inversion table or a teeter hang-up. When you are in one position for too long, you can get muscular relief. You can see your pain decrease, but absolutely nothing is benefiting the disc. Instead, decompression is like an accordion or a slinky. It'll stretch and relax, stretch and relax. Or the same way you can pass a slinky back and forth between two hands, the same is true with decompression. That up and down stretching motion and relaxing following it will actually pull fluid into the disc, allow you to heal, and over time you can maintain that fluidity level, maintain those improvements, and see your symptoms fall by the wayside. All it takes is the weight of a dime, yes, the coin, a dime, to decrease the effectiveness or the functionality of a nerve. So when you can take a compressed disc and even just increase it by a little bit, you're going to notice that your pain decreases, your mobility increases, and your quality of life becomes what it should be. A damaged disc is not going to be perfect, but what we know is the following. Decompression is far more effective of a treatment for a disc issue than plain old traction. Chiropractic, combined with the deflaming techniques of laser, electric therapy, electric stimulation, and a couple exercises that we'll go through, can make a person's life 60 to 100% better. After all, no two people are the same, and even if every person I see has the exact same symptom that day, let's just call it sciatica for the sake of this therapy, even no two sciaticas are the same. There's a difference in location, disc impingement, irritation, bulge, herniation, fusion, laminectomy, or maybe it feels like sciatica because of something we call piriformis syndrome. So while this therapy is great for compressive issues in a disc, the other important piece of the puzzle is to make sure you are indeed addressing the right area, because symptoms like sciatica, which can show up for a number of reasons, would not benefit from a chair like this unless the disc really is involved. Now this chair here is what we use for decompression, specifically for folks who maybe can't lay face up. A lot of people we see are so compromised that instead sitting is the best position they can get in. This chair will actually tilt upwards in that sitting position, so it's non-strenuous, it's easy, pain-free, and at the end of just a couple weeks, we see people walking, improving, smiling, and many times without their canes anymore.